we've always known that meibomian glands are an issue. It's only now that we really have a treatment that is this effective to go after the problem at such a fundamental level.
LipiFlow applies heat to the eyelid from the inside. It's really impossible for us to do that by any of our existing methods. We're therefore putting the heat directly in contact with the meibomian gland along the entire length of the gland. So we heat the secretions that are inside the entire gland. This allows them to flow, and we think it's partly because of this that we get sustained flow from those glands and sustained symptomatic relief for our patients.
And certainly this is very exciting not only to the patient but to us as clinicians, because again, it did not require ongoing treatments with any other types of regimens. It didn't require a prescription medication that they were on. Simply an outpatient procedure that they received in my office enabled them to have improved comfort.
This is really a new step in the direction of assessing the quality of someone's tears before the damage is done.
The tear film is a marvelous creation, complex, more complex than we originally realized. The innermost layer being the mucin layer, which addresses the surface tension properties of the tear film, allowing the wettability of the surface. The largest middle layer is the aqueous layer, produced largely by lacrimal and accessory lacrimal glands. And then the outermost layer is the lipid layer, a layer that we understand helps to stabilize the tear film.
Nature went ahead and provided a bountifully thick lipid layer on top of the aqueous layer, that's the watery layer, to preserve it, to anchor it, to act as a roof on top of it.
The lipid layer, of course, is produced by the meibomian glands, the layer of glands that line the eyelid. And, of course, meibomian gland disease is one of the chief causes of not only dry eye symptoms, but also symptoms of blurred vision in our patients.
And by opening up the duct, we allow that gland to upregulate. And we have data to show that individual glands, after removing the obstruction, can upregulate.
Now by applying the heat in the appropriate place, and that is posteriorly on the tarsal plate, and with a measured quantitative amount, we're able to, for the first time, to get the contents of the meibomian glands heated to the level that it actually becomes effective.
LipiFlow is entirely different from any other treatment we've had before for meibomian gland disease because it gives exactly the treatment that's needed right where it's needed. We take heat and we put pressure directly on the meibomian glands to express those glands and to remove the inspissated secretions that are blocking the flow. And it restores natural flow in a very natural way.
And it's a very sophisticated device itself that allows the miniaturization of all of this and applying that level of heat with the compression factor precisely and within very, very, very narrow tolerances.
One of the strategies that I found very useful in having a patient understand their disease is to give them some sort of visual reinforcement or visual picture of what their problem is.
The LipiView technology is using interferometry to look at the tear film in a manner that we just haven't done before.
And we have a way of treating it that gives both effective and sustained relief.
For the first time, we have an actual treatment regimen that a patient can undergo in the doctor's office.
When you think of the large number of patients that this could apply to, it's very, very appealing technology.
The treatment of meibomian gland dysfunction and evaporative dry eye has always been an enigma. And the reason is, again, because the doctor couldn't see it.
We see so many dry eye patients who have some degree of meibomian deficiency, some degree of aqueous deficiency, and knowing exactly where to direct our treatment is fairly difficult when there's guesswork in the equation.
The patients really enjoyed seeing us look at some evaluative image of their tear film. And when you can show a patient, this is your tear film, and this is what a normal tear film looks like, and here's the problem,
Previous methods of treatment involved a lot of homework for meibomian gland dysfunction, for meibomitis, for all of the forms of lipid deficiency and evaporative dry eye. If they were treated in the office, the pain bordered on being barbaric.
The thing that the LipiFlow offers is you're going to where the problem really is.
The LipiFlow has the ability to not only heat all of the glands and heat them from the back where the heat is effective. Not only do that, but has the ability to milk the glands as well as any individual could with their fingers, while simultaneously applying uniform pressure to both the top and the lower lid to allow the heat to be maintained and prevent the veins from wicking it off.
And by opening these glands back up and allowing them to function again, hopefully function again, so that these patients can have a much more normal tear film, that's what we're trying to achieve with this system.
I'm very excited about the LipiView system and the LipiFlow system because for the first time we're going to have, I think, a really good quantitative way of looking at the tear film, and we finally have a treatment that can be done as an outpatient in the physician's office, delivered by the physician and their assistants, to give patients a meaningful improvement in their disease.
It's sort of a satirical irony on the fact that no matter how good you are as a clinician, you can't see most of meibomian gland dysfunction at the present time because it's inside the gland, and it's a question of whether or not that gland is secreting at any given time.
With LipiFlow, we get very consistent pressure over a sustained period of time, and when combined with the heat, this is ideally suited to soften and express the meibomian gland contents.
We're moving into a new era where it's going to be really one of the next big things in the field of ophthalmology.
LipiFlow is going to give us a chance to have a sustained method of giving relief to these patients through a simple office procedure that just takes a few minutes.
They're going to get some immediate results, and they're going to get immediate participation in getting their meibomian glands functioning.
Most of them over the period of the first week or two definitely noticed a significant improvement, not only in their comfort level, but many of them in their level of vision as well.
So having an alternative treatment for meibomian gland dysfunction that will give not only an effective treatment, but a sustained benefit is a huge advantage to us.
My experience in the FDA trials was very exciting with LipiFlow, and I fully expect that once it's approved that this will become a major part of my practice.
It's going to redefine treatment in patients who have been in desperate need of something more than we've been able to offer them until now.